Let's turn our attention now to one effort underway in the Valley, a new effort to prevent child drownings, a helicopter in the Valley that's trying to raise awareness about this very important topic. And Dr. John Shufeldt, who's with Native Air, is going to tell us all about it. Hi, John.
Hi, Marty. How you doing?
Great.
Unfortunately, it's a very timely topic today as we lifted off from St. Joe's. We saw that poor, unfortunate child being brought in there. In drowning prevention, you almost can't emphasize it enough. In the last 5 years, there's been 269 drownings in Arizona. And the really sad part about that is only 6 of those drownings were in pools that had a pool fence and a lock gate. We're out here in Peoria, actually, Teacher Linda's swim school, and looking at this Native Air helicopter. This helicopter, basically, the genesis of this was Mike Todd. Mike, why don't you tell us how you came about this?
Sure. Basically, this was just an idea to basically take our message to the air. We wanted to create a helicopter that sparks a dialogue between children and their parents, children and their grandparents, and just really get the message out to prevent drownings. Every time we land at a scene, children come running from everywhere to look at the helicopter. This was a new, innovative way with the Arizona Drowning Coalition of Central Arizona to take our message out, prevent drownings. And we put some photos on the side of the helicopter that basically just explain exactly what we need to do. You see a photo right here of Teacher Linda teaching a student to swim. Over to the right, you've got firefighters who are trained in CPR. We want to encourage everybody to learn CPR. CPR does save lives, and it makes a tremendous difference when it comes to a drowning. Now,
it says on the top of this, Mark, I'm not sure if you can see it, if you don't put a barrier around your pool, someone else will, and it's done in the yellow police sort of tape. I wanted to talk a little bit to the flight crews in here who land on the scene of drownings. Tell us what happens, Steve and Teresa Moody. You land on the scene of a drowning. What's the first thing that's running through your mind?
Initially, we're just trying to make sure that patients have heartbeat, breathing, and if they don't, we're trying to support that using the different interventions we have here in the helicopter to get them where they need to go with, breathing and heartbeat.
Right. Teresa, show us some of the equipment that you're using.
Okay, this here is an ambu bag. We use this to actually help ventilate the child, blow oxygen into them. This here is an ET tube. We slide that down into the child's airway. After we use this laryngoscope to see the anatomy that we're looking for, slide this into the airway, and this connects to the ambu bag.
And that helps them breathe?
This helps them breathe. This delivers 100% oxygen, and we actually control their breathing, the rate and the depth.
Now, I'm going to speak for these two when I say they never want to meet you and they never want to see your child. The best thing that could happen is this helicopter never takes off on a pediatric drowning. This year so far, with today, there's been 45 incidents of drowning and 13 deaths. And it would make these flight crews' day, never have to go on another one. It would certainly make our day. When we come back, we're going to meet Teacher Linda, who's worked in the Valley for years, teaching children and adults on how to swim to prevent drownings.
I'm going to definitely stay tuned for that. I know I have Kate in swimming lessons, and it doesn't take the place of you watching your kids, but you got to think it helps somewhat, Dr. John.
Exactly.
Thank you very much for that, and we'll join you back in just a few moments. Dr. John Shufeldt is out with Linda. Linda has a swimming pool school here in the Valley, and I think probably one of the best things you can do, John, is to teach your kids how to swim.
Absolutely, Marty. We are out here in Peoria with a Native Air helicopter, the Drowning Coalition, a drowning prevention helicopter, at Teacher Linda's swim school. And one thing I want to put in perspective, and we talked about it this a little bit before, 269 drownings in the last 6 years. About a kindergarten class every year drowns, or about every year drowns, and it's really tragic. Linda, what can you do to prevent that?
Well, we have our swim school here, and we start kids at a really young age. We try to kind of get them to comfortable in the water. We try to, teach the parents. They need to watch their kids around the water, make sure they have fences around their pools, and just, try to be real positive about it.
Now, how did you get into this?
I've been teaching for over 20 years. I really don't remember how I got started. It was a summer job, and it just kind of evolved into what it is now. I used to teach in my backyard, and it just kind of grew from there. And it's really rewarding when you see all the drownings that we see here. I just feel that we're kind of helping out. Every day I hear moms come in and tell me that their kids fell in the pool and, got themselves out to the side and with a big grin on their face, and that just makes everything worthwhile.
It's got to make your job so rewarding. Tell me, kids, you mentioned that something's changed recently. Kids fall in the pool now. What do you teach them?
I teach them when they fall in to roll over, float on their back, get a breath. If they need to, call for mom, or if they just want to lay there and float, they can just lay there and float. We make it a real positive atmosphere so that when they do fall in, that they're relaxed, they're comfortable, they're not afraid, because it's scary when you fall in the water.
Right. So Teacher Linda, tell us, how do parents get involved with you out here?
Mainly they just contact us here. They see things like this and they realize that they need to get their kids in swimming lessons. And we do start them really young.
About 4 months old?
Well, I recommend usually 6 to 8 months is when we really get them started.
Okay, very good. We're also back out here with Dr. Michael Christopher. Actually, Dr. Christopher is one of the Arizona's top docs, and he's the medical director at St. Joseph's in the emergency department. Mike, how you doing?
I'm doing very well, John. How are you?
Good. Give us your perspective on drowning, because I know you have one being in emergency medicine.
Well, any emergency physician that's been in this business for any length of time, this is a subject that touches their hearts. It's tragic. There's nothing worse than going to a parent or a caretaker, and they can tell when you walk in the door by the look on your face the outcome. And it happens every year of my career. I've been doing this for over 15 years, and there's really no end in sight that I have seen in terms of volume, in spite of all the efforts that we're seeing right now. So what that tells me is vigilance is the name of the game, and we've got to keep it up. What she's doing is fantastic. The barriers are fantastic, but nothing is better than vigilance on the part of the parents or the caretakers, watching, never taking your eyes off kids around water. That's the bottom line.
It's definitely one of the hardest things I've ever done is telling parents, you know, with that look on their face, if only I would have.
Oh, if only you would have. The same story is heard every time. I turn my back for just a few seconds, not even a minute, and the same outcome. So, you know, obviously there's more that needs to be done. And again, my feeling is, and I tell anybody that asks, you just never take your eyes off of them. That's just the bottom line.
I guess that's a take-home message. Marty, we wish we were out there back at that pool with you, because out in Peoria, Arizona, it is not cool.
The humidity really seems high today for some reason.
What about the pool?
All right, thank you very much, Dr. John Shufeldt, for those great tips. And welcome back, everyone. Time now for our Top Doc segment, and I can only imagine what it must be like in an emergency room any time of day.
Well, Dr. John Shufeldt is joining us from St. Joseph's Hospital with another Top Doc segment, and he's talking to one of the best in the field. Hey, Doctor.
Hello, Scott. Hey, Marty. How are you both?
Great.
Terrific.
We are back over at St. Joseph's Hospital with Dr. Michael Christopher, one of the area's top docs and practitioner of emergency medicine. Mike, welcome.
Thank you. Glad to be here.
Hey, tell people what is it? What's in your background and training that differentiates you from another non-EM physician?
Well, emergency medicine is different in a very important way, and that's that we deal with unscheduled care. We don't have appointments. We deal with people in crisis or people that have no access to health care otherwise. But one of the biggest differences in our training is how we think about problems, how we approach them.
Give me an example.
Well, a great example, you know, people come in with abdominal pain. Say it's an elderly person. This could be something as simple as a stomach flu. It could be something as catastrophic as an aneurysm that's about to pop.
Right.
So the way that we're taught to approach patients is think of the worst possible thing it could be and then work your way backwards. And that's the safest approach.
Now, how's the training different than how it used to be, for example?
Well, years ago, this institution here has been on this location since the 50s. And way back when medical staff, all the physicians on medical staff, be it radiologists, surgeons, pediatricians, would take turns covering the emergency department. It was obviously a high anxiety place for, say, a dermatologist to be, and a heart attack patient could come in, and obviously we weren't serving the population best by not having specialists designed to recognize serious illnesses and injuries, and then make sure you get the right doctors in there to take care of them.
Right, so in your training, I guess to sum it up, is you really have a lot of training in critical care medicine and then all the different subspecialties of medicine, picking out the worst case scenarios and making sure it's not one of them.
Absolutely. We have to be comfortable with really all areas of medicine. From pediatrics, I was going to say all the way to geriatrics.
Right. I think one thing people are going to want to know is there a difference in the emergency departments in any particular city, and how can somebody find out what that difference is and then go to those emergency departments that are best suited for their needs?
Well, that's an excellent question. It really depends on the location of the hospital and the type of staff that they have available for backup. An institution such as St. Joseph's, I'm proud to work here because we have a really deep bench. Anybody that I could ever conceive of needing specialty-wise is here. Unfortunately, in a lot of outside community hospitals, they may not have an orthopedic surgeon on call. They may not have an ophthalmologist to deal with an eye problem, in which case you would need to be transferred. That certainly can delay care, and it is not a very good patient satisfier, certainly. So an institution such as ours that can handle anything is really where you'd want to bring anybody that's really sick or anybody that has a significant injury.
Right, anything, any time of the day or night. Well, Marty and Scott, when we come back, we're going to talk to Dr. Christopher and kind kind of give the audience some hints. When do you go to the emergency department? When do you go someplace else? And where else can people go if they have an emergency that may not be life-threatening?
I tell you, that's stressful, having to just be there and then be ready to take whatever comes in through the ER. That would be scary for me.
It gives you gray hair.
I just call my buddy Dr. John Shufeldt. That's what I do.
And he flies you there, right?
He flies over in his personal helicopter.
All right, well, we'll look for that coming up in the next segment.
All right.
Thanks.
Thank you. Let's head out to Dr. John Shufeldt instead, and he's down at St. Joseph's Hospital giving us a tour of the ER down there. Hey, Dr. John.
Hey, Marty. Hey, Scott. One thing we can't help you with, Scott, is your hair, but we can help you with a lot of other things. Mike and I were talking before the break, and there was an accident yesterday that you probably heard about. It was out where someone was driving along in a pickup truck and had a bunch of children in the back and rolled the pickup truck, and all the kids flew out of there, and all were flown to different trauma centers. Gives people some ideas, being an expert. What do you see on a daily basis you could think, wow, if only they would have done this, only they thought of this?
Well, you bring up a great point, and this is a personal issue for me that I see every day when I'm driving back and forth to work. But you see children unrestrained in cars, running around in the back seat, oftentimes with the parent in their seatbelt, and that always just really irritated me. Prevention is key here. The #1 killer of children is trauma.
Right.
And riding in the back of a pickup truck, not using safety equipment, on the back of an ATV, even simply inline skates, bicycles, not wearing the proper equipment, is just asking for a bad outcome.
Right, I always see parents with their kids in their lap, and they go, you have a nice little airbag there sitting on your lap, and the child's unrestrained.
It's infuriating.
Right.
And it's difficult. It's a cultural thing that needs to change. I think we've come a long way since I was a child. When I was a child, my mom would hit the brake suddenly and then throw her arm out like that to keep us from flying forward.
You fly out of the Model T.
Yeah, so you got it. Thank you.
Okay, kids with fevers. What advice have the parents? Because you see a lot of that coming in here. What advice do you have? When can they stay out of the emergency department?
That's an excellent point. Children with fevers are a very common presenting patient here in the emergency department. And when a child, particularly an infant, gets a high fever, they look terrible. They're fussy. They look really sick. It's very concerning to parents. They often bundle them up and race to the closest emergency department for evaluation. What we often find when they get here, ultimately after a few hours, once the fever has come down, the child turns around. They're running around the waiting room eating Cheetos and having a great time, and it turns out they have a virus or a minor illness.
So wait and see a little bit.
Right. Well, the point I would give parents is treat the fever. Give the appropriate amount of Tylenol or ibuprofen. Give the child about an hour and reassess them. And more often than not, 9 times out of 10, they'll return to their charming selves, and you have yourself the opportunity to now come back to your pediatrician the next day or 2 days later. It just buys you some time. It takes the concern away.
Okay, and then just real briefly, how do you know when it is time to come to the emergency department, be an adult or be an adult or child?
Right, that's a great question. And everyone has to define their own emergencies, but there are certain high-risk areas, such as chest pain, for instance.
Right.
If you think you're having a stroke, if you're having weakness, obviously that's pretty obvious, but numbness, tingling, sometimes bad headaches like you've never had before.
Right.
It's better to err on the side of caution and let us, the professionals, evaluate.
Very good. Well, Mike, thanks for being here. Marty and Scott, you've heard it right out of the horse's mouth when they come and how to stay, how to stay away. And if you want more information on one of our top docs, go to aztopdoc.com.
I think he was talking about me when he said people who bring their kid to the emergency room too much. I'm just teasing.
No, not at all.
And there's that website again. Thank you so much, Dr. John, and all the folks out there at St.
Thank you. Good job. We'll talk to you next time.